Hi everyone, Dr. Remy from Pain Free and Fit and Walkaway Back Pain. Today, a great walking exercise for those of you with lower back retrolisthesis, accentuated hip extension. Hope you enjoy. So for those of you with retrolisthesis of the lower back, where the vertebra has become unstable and actually slips slightly backwards, remember that, as we've explained in other videos, retrolisthesis is generally aggravated with flexion. And that's because many times with retrolisthesis, the discs also have a problem. The discs have either herniated, degenerative, bulged, and with flexion or bending forward from the waist, the lordosis or curve in the lower back becomes decreased and more pressure is put on those discs, compressing them, as well as mechanically, when we lose that curve or that arch of our lower back, it helps to generate a backwards force, pressing that retrolisthesis further backwards. So one of the things that we've talked about for those with retrolisthesis without neurological compromise, meaning without foraminal stenosis or central stenosis or sciatic pains due to compression or overarching of the back, is if we increase the arch of that lower back, if we increase that lordosis, it's going to help relieve pressure of that flexion on the discs, and it's going to help to relieve that mechanical pressure that drives that retrolisthesis backwards. Because as we increase the arch of our back, as our tailbone moves upwards and pubic bone goes down and our pelvis tilts into an anterior pelvic tilt, or as we extend our upper back backwards, when we increase that arch, it helps to take that retrolisthesis vertebra and mechanically help it to have a pressure that moves more forward. Remember, with retro, it's rare that your actual vertebra is going to be slipping back and forth. Most people are not that unstable. But what we're talking about here is the stresses that go into that. If your retrolisthesis is already backwards and your discs are irritated, more flexion is going to irritate that. It's going to irritate the soft tissues, everything from the disc to the facet joint capsule to the surrounding soft tissues, ligaments, muscles, fascia. So what we're going to do with this walking exercise is we're going to learn how to extend the hip or bring the leg backwards from the hip joint, which is associated with an increased arch in the back. And that is going to help to relieve those forward pressures. Doing this several times a day, we're using it to build up over time into greater and greater levels, both in terms of range of motion and time spent walking, can help to change the mechanics of your lower back. It can help to stimulate more growth and strength in your erector spinae muscles, your multifidus muscles, and your glute muscles, glute max muscle. Typically with retrolisthesis, because of the forward flex postures that a lot of us get into, especially with retro, that I found in 30 years of helping patients, weak buttock muscles, weak multifidus muscles, the extensors are weak, so we want to build those up. So here we go. Here's how we're going to plug that all into our walking step. As you walk, you're going to accentuate both the range of motion and the time spent with the leg back. So what that means is, as you walk, think about stepping either a little further than you usually do, or pushing your leg back a little bit more, or spending a little more time with the leg back before you begin to pull it forward. Any of those three variables, by increasing the range of motion and the distance that the leg goes back, or the accentuated force that the leg goes back, will help to engage the buttock muscle, multifidus, erector spinae, and as we walk, that's going to help to increase the arch in the back. You can actually try this when you walk by putting your hand on your lower back, and as you walk with normal steps, there'll be a certain curve to your lower back. As you accentuate backwards leg motion, you'll notice that curve deepens. And as we deepen it, those muscles are contracting, the arch is increasing, and that retrolisthetic vertebra has now more of a favorable force, forcing it forward as that arch increases, many times relieving soft tissue low back pain due to lumbar retrolisthesis. Plug this into your walking exercise, see if it helps you. Remember, you need to make sure that you have your RPI or neutral spine on when you do this walking exercise or any exercise for retro. That's a unique posture because some of us will have a tendency to hip hike or have one hip come up more than another. Some of us may have a slight pelvic rotational problem, a lateral translation problem with the ribs. You may have a dysfunctional internal oblique or external oblique muscle that's causing a torque in the low backs. So you want to plug this walking exercise in with your full mechanical corrections, addressing all of your stability issues that are affecting your lower back. Again, if you don't know what that is, check out our free body analysis at painfreeandfit.com, or looking for a great walking program to help with your retro, check out our walk away back pain program available at painfreeandfit.com. It has all the exercises, all the analysis, simple ways like this exercise where you don't have to go to the gym or spend separate rehab sessions, but you can actually help your retrolisthesis and your own self-management skills, your own self-rehab, by changing the way you walk, changing your mechanics, by addressing your mechanical issues. And if you're looking for more of a program for your retrolisthesis, check out our Fast Track program for retrolisthesis, also available at painfreeandfit.com. It has not only your analysis, but it has a ton of different walking exercises, stretches, coordination exercises, strengthening exercises, both in and out of the gym, for you to perform a self-designed rehab program for your lower back pain that's caused by mechanical stress to your retrolisthesis. I hope you enjoyed this video on retrolisthesis pain and hip extension walking. Feel free to subscribe to our channel if you'd like to get some more videos to help understand how you can self-manage your low back pain. Questions or comments, write in. As always, I'll do my best to answer. Thumbs up to help me share this valuable information with others. And I hope this video on retrolisthesis, hip extension walking helps you with your chronic low back issues.